Welcome to Medical Alerts. Today we have Dr. Major Ashlesha Tawde, retired, with us, and she's going to speak to us about the healthcare of India, the future of healthcare in India. Over to you, ma'am.
Hi, Prakhar. Thank you so much for inviting me, and it is really been nice. It is lovely to actually speak with you face to face, if although not in person.
Honor
I
is mine.
am not really an authority, really, to talk about, but I can definitely tell you about a few of the things what I could see and I came across in a past few years that I have been working in healthcare, and my specialty being community medicine. What
Yes,
I've
ma'am.
seen in the field areas, as well as when it comes to hospital, um, and in the community. So that kind of an experience that I have, I can share a few of things from that, maybe, if I can.
Yes.
So I hope I add something to our listeners or viewers the end of it. But uh, uh, healthcare in India has seen a real facelift, or it has undergone a transformation, and not really undergone. It is in the process of transformation in a big way, and especially last right now we are in 2023. We are towards the end of 2023. The COVID pandemic actually, as accelerated the whole transformation. Not that it was not coming, but the pandemic actually accelerated the whole process of transformation. We all know that India is a country of young, right?
Yes.
So the digitalization, or the improvement in standard of care, etc., is it was inevitable. Uh, Probably it is one of the boons that the pandemic has given, is the acceleration of some of the processes, some of the methods in healthcare industry. Uh, Having said that, healthcare industry in India has a lot of untapped potential still. But there are some major trends in the industry which are to be seen, or to be looked out for. And the first and the foremost would be acceptance for telemedicine. So last 5 years or so, so from here, so 2018 or so, we started at a national level. We had infrastructure, and a momentum was gained for telemedicine and digitalization. But immediately in 2019 we had pandemic, and that process actually really hastened, and we went into not just telemedicine, but we actually launched and successful at it. We were let's say we were one of the most successful countries to
Mm.
handle that pandemic, and that at that scale, um, with digitalization. So something which was in the labs and which was in the works, straight away came into the palm of each of the Indian,
Yes.
in terms of Arogya Setu, or let's say later on Covin app.
Mm. Yes.
So at the same time, telemedicine, which is basically you know seeing a patient or diagnosing and treating a patient online, without physical without physical interface, really. That was not really an accepted way. Come on, I mean, when
Mm.
we are a country where even if we want to have our grocery, even चावल भी अगर लेना है तो घर में जो लेडी है या जो हेड ऑफ द फैमिली है, वो चावल का दाना देख के उसको हाथ में ले करके उसको you smell it and then you say हाँ ये वाला चावल है. So forget healthcare online. So we are that kind of community or society, and suddenly telemedicine got a really wider acceptance in our society, in our community, and that is a trend that we want to look out for. Basically, our healthcare industry, it is growing in the sense that from probably 80 million, 800 million to probably thrice that in next few years. Million US dollars we're talking about, and it's a growing industry in which telemedicine becomes a mainstay or a growing trend now. As we are young, we will also be seeing aging population in coming few years, right? So the infrastructure, the facilities which will be suitable, which will be comfortable for aging population, for growing population, is like telemedicine, is being built at national level, and globally it has got a wider acceptance. Another trend that we see, or the healthcare industry important movement that we can see is remote monitoring. Okay. Because of the industry of growing or development in the industry, or advancement in technology, we have got such connectivity and tools in the sense or which are useful for remote monitoring, both for patients inside the hospital and inside their houses, right? So a few days back or a few years back, we could not think of a meeting like this, or an interview or a talk like this. This is not an interview, it is we are chatting. So we did not think where my medical students, can you imagine medical students sitting at home and attending a clinic? But that happened really. And in our times, we didn't even get to sit while the clinic was on. And here my students were sitting, and I don't know, it was a superb thing to see. So the clinic happened online and things like that. So remote monitoring, even exams happened like that, right? So remote monitoring of patients, remote monitoring of ICU, and even remote monitoring of people, patients, or beneficiaries who are in remote places where actually the clinicians cannot reach. But with that particular device or a particular app, you are able to. I work in community medicine, and maternal and child health is my, is very close to my heart. So we have high risk pregnancies, which are, in tribal region. They if they have to really reach a center, they have to travel 2 hours or 3 hours one way, and some of it is walking, really barefoot, and on foot, sorry. And to avoid that, if nowadays we have these apps which are given to the community health workers. Now, community health worker who's an Asha or Anganwadi worker who reaches the house, she's from the village. She reaches the house, she sees the well-being of the lady, right? Her basic parameters are checked, and then she can actually upload those vitals of hers, the basics of her vital parameters, and then the person who's sitting at the center can actually be rest assured that she is uh, safe, and she's following the treatment and things like that. Transformational diagnosis or transformational medicine is basically based on genome sequencing, and RNA based tests, etc. So that is as well got a really big boost during the pandemic. But India being such a hub for the technology, we now have the kind of diagnostics and technology which will see, which is let's say the pace of the future. We have and now we won't anymore be having fixed dose combinations and things like that. It is basically medicine and therapy and treatment tailor made to the individual, or the individual and the disease. So that kind of thing is something which is upcoming. And with AI or artificial intelligence coming in big way in healthcare, you will have almost miraculous inventions in healthcare with the transformational or let's say genome sequencing kind of tests as well as medicines. Very simple is where you can have your DNA mapped, and you can predict the risks of a particular disease in a particular individual, right? And when you predict a risk, it's not just you predicting like like somebody seeing your horoscope. It is actually like a horoscope, but somebody actually seeing the future, right? And we have the kind of preventions that we have. When we put them in place, we are able to actually delay the progress or even the onset of many non-communicable diseases that we are dreading, the community as a community, as a society, right? So that is another thing which is superb, that we want to look forward to. And then there is healthcare software as a service. Now we are talking about not just let's say doctor and patient, but then there are other stakeholders in India as well. It used to be that particular doctor, just outside and right at the corner of our, our locality, who would know everything, the entire history of 3 generations of mine, and he would know what to give. And slowly that changed to specialty and super specialty and things like that in cities. Right, in cities. But it was not the same in rural area. And even today, India is 65 plus% is rural.
Correct.
Right. So there is a lot of let's say disparity still existing, but and that is why we say there is a lot of untapped market which is still existing, and that is why large multinationals are looking at India as a market, and that is where we have more than doctor and patient. There are more stakeholders than that in healthcare now. So we have health insurances, either private or government insurances. We have pharmaceuticals, and we have research and those people, so researchers, etc., in as stakeholders for healthcare industry. that makes particularly the software or technology as a service which is offered to the healthcare industry or healthcare personnel. So, as a doctor, I am no more dependent only and only on my clinical skill, as in my hands, right? And whatever I have read. There are more technologies which are at my disposal, which are offered to me as software, right, where we talk about AI and things like that. So these are useful both for urban as well as rural. When we talk of AI and when we talk of ML, uh, we always think it is something fancy, something really advanced, where robotic surgeries and 3D printings and things. But then in India, when we talk about AI and ML, it has its own face, it has its own let's say charm, right? So in the sense that we have like I said, rural population, the factors which are responsible for a particular disease in rural are many a times completely different than those who are which are responsible in urban area or urban population. So when it comes to AI or ML, to develop a an algorithm, to develop an app for our kind of population, which is diverse, it is a challenge, as well as it's really um uh, it's really an opportunity in itself. And the kind of brains that we have right now at work, we actually are coming up with really good softwares. And why I say that, because even the technical, as in IITs
Mm.
and technology firms, are interested in healthcare now. So
Yes.
that's the trend which we see. I have been speaking, and in fact nowadays there is a lot of push is being given on collaboration between technology and
Mm.
healthcare. We as doctors were not taught coding,
Yes, ma'am. Yeah.
but with time, when it is going ahead, I want my students to know what it takes probably to have an app which is healthcare app,
Medical coding as
not because they want to do the coding or they want to develop an app, but because they should know if somebody is offering them an app which will probably, monitor their patients, whether it is good or no, whether it is helpful, what elements they want to see in an app or in a service as a software, so that it helps them, so that it augments their skill and their workflow. So with AI and ML coming in healthcare, people ask whether it is going to replace doctors or the healthcare professionals. That does not happen. I mean, people were worried before computers, that the computers will come and the clerical staff will go away. That does not happen, right? It just augments the health. It just augments the workflow. I'm not comparing clerical with doctors here, um, but the workflow kind of. So what happens is some parts of healthcare gets augmented with the help of AI and ML. And this is what we are looking at. And this will be throughout, in rural, in urban, in public and private sector. So that is something that we are looking at. Government of India is really coming up with, I mean, it has come up with Ayushman Bharat Digital Mission. So Ayushman Bharat Digital Mission itself um, is It is the largest program. Let's say Ayushman Bharat has two pillars, digital mission and Pradhan Mantri Jan Arogya Yojana. Both of them have technology at the core of it. Pradhan Mantri Jan Arogya Yojana, the largest government-run healthcare insurance in the entire world. We know that, right? And successfully run. We have technology at the core of it. This much is the importance which is given to technology in coming years in healthcare. So that we cannot neglect and cannot do away with. So I feel these are some of the things, and there are key avenues of growth and diversification in healthcare, because being a doctor need not just have need not just be one way to go or look at it, but even doctors now have a larger avenue or versatile roles in healthcare. It is the whole focus is now shifting from illness to wellness, right? So when we talk of rural side, we don't have just sub centers anymore, but we have Arogya Vardhini centers. The committee or the samiti that we used to call Rogi Kalyan Samiti is now called Jan Arogya Samiti or JAZZ, right? So the whole system is being jazzed up. And like I said, it is not focusing illness, but it is focusing wellness now. So you fall ill and then you reach a doctor. No, you do not fall ill, for which you need a healthcare professional. And that is the lookout that we are. That shift in thinking has come in a big way. And for that, whatever it takes is being done by even the government, so that they reduce the out of pocket expenditure, so that they reduce they target NCDs, non-communicable diseases. Of course, communicable diseases programs are ongoing. So we see, let's say, multi-pronged approach to healthcare, and at a higher level we have technology which is driving force behind all of it, because we want to stand and we want to lead the world.
Correct.
In healthcare industry as well as in others. So it is upon us to accept and even develop something which is unique for our kind of setup, because the kind of diverse society that we have, we can't just simply accept somebody's model and implement it in India. We have to develop our own, and that is what we have been and we are developing. In these few coming years, we will see the the fruits of it. We have Abha card, right? Ayushman Bharat health account. We have doctors registry. We have registrations for healthcare facilities and so on. We have focus on the generic medicines. We have registry for drugs as well, right? And laboratories. So not just doctors registry there, we also have healthcare, other allied healthcare professionals registry. So all these things are basically making the whole system of healthcare more transparent, more interactive, and more, talking the language of young and global language. So we are coming up in a way that we become global leaders even in healthcare industry. And that is what I think the future years, coming years, are going to see. I am really proud and I really am excited to be a part of this kind of, transformative or futuristic healthcare industry today in India. And I think we all must be proud of
Yes,
this vision and should be supporting this mission as well.
yes, yes, ma'am. I feel you gave a brief about everything, and it's a really nice interaction and really nice talk that you brought upon,
Yes,
focused on all the points. We're fine, I guess, now.
right. All
Yes,
right. So thank you so much, Prakhar. This was really great. And I really hope we brought out
yes,
whatever we were
yes, ma'am.
thinking good.
Yes, ma'am, you did. Thank you so much for this interaction, ma'am. Thank you for taking time out of your. I know how hectic it must be. So,
Right.
thank you for giving us your precious time, ma'am.
Thank you so much, Prakhar. It was great seeing you after interacting for a long time.
Yes, ma'am. Hopefully, more interviews in the future, ma'am.
Yes, hopefully I see you in person as well.
Yes, ma'am. Hopefully, soon, ma'am.
Right. All
Okay.
right. I take leave and
Yes.
all the best.
Thank you so much. Thank you.
Jai Hind.
Jai Hind.